Hello everyone, welcome. So today we're going to demonstrate the Ankle Brachial Index Test, or ABI. This is a simple, non-invasive bedside procedure used to detect peripheral artery disease, or PAD. PAD is caused by narrowing or blockage of arteries in the legs, reducing blood flow. The ABI test compares systolic blood pressure in the brachial arteries of the arms with systolic pressure in the dorsalis radius and posterior tibial arteries of the ankles. This ratio provides a reliable measure of arterial perfusion. ABI is quick, inexpensive, reproducible, and is considered the first-line screening tool for PAD. The ankle brachial index test is indicated in several important situations. First, it is used in symptomatic patients. This includes those with intermittent claudication, which is pain or cramping in the legs during walking that improves with rest. It is also indicated for patients with rest pain, non-healing wounds or ulcers on the feet and legs, and in severe cases, gangrene or tissue loss. Second, it is valuable in asymptomatic but high-risk individuals. This includes patients with diabetes mellitus, hypertension, hyperlipidemia, a history of smoking, advanced age, or a family history of cardiovascular disease. Even if they do not yet have symptoms, these patients are at increased risk for peripheral artery disease. Third, the ABI is indicated when physical examination findings raise suspicions of PAD or PAD. Examples include diminished or absent pulses in the lower extremities, cool or pale skin, or trophic changes such as hair loss, shiny skin, and thickened nails. Fourth, ABI is used in preoperative assessment, particularly before vascular surgery, angioplasty, or bypass procedures to evaluate arterial flow. Finally, ABI is important for monitoring purposes. It helps track the progression of peripheral artery disease and assess the effectiveness of medical therapy, lifestyle modification, or revascularization procedures. In summary, ABI is both a diagnostic tool for detecting PAD or PAD and a prognostic marker for cardiovascular risk, making it essential in both symptomatic and high-risk patients.
Hello, ma'am. Good morning. How are you? I am Christine Joy Pastor, and I will be your nurse for today. May I know your name and your birth date?
I'm Salvo. I was born on December 13, 2007.
So today we will be doing the ankle brachial pressure index test, which means I will be getting the pressure of your arms and legs. Before we proceed, I will just get all the equipments needed, and while I'm getting it, you can just relax and wait for me, and I'll be back.
So now we're done with your examination, ma'am. So your legs pressure is higher than your arm pressure. Your ABPI is greater than 1. That means that you have a good vessels. We're good now. Thank you, ma'am.
To calculate ABI, we use the formula ABI is equal to the highest ankle systolic pressure, either the dorsalis pedis or posterior tibial, over the highest brachial systolic pressure, T. Remember, ABI must be calculated for each leg separately, since PAD or POD may be unilateral or asymmetric. For the normal and abnormal findings, interpretation of ABI result is as follows. Always interpret ABI results in the context of the patient's history and physical examination. For conclusion, the ankle brachial index is a cornerstone in vascular assessment. It allows clinicians to detect PAD early, determine its severity, and guide further testing or interventions. Accurate technique, including proper cuff placement, correct use of the Doppler probe, and precise recording of values, it ensures reliable results. By combining ABI findings with patient risk factors and clinical signs, we can improve outcomes through timely lifestyle changes, medical therapy, or referral for vascular procedures. Early detection of PAD not only prevents limb loss but also reduces cardiovascular morbidity and mortality. So that would be all the ankle brachial index test from Group 5. Thank you for watching.